Hey everyone, it's Nikki. Today is Thursday, April 3rd, and today's video is going to be about my favorite feeding tube supplies and also mobility aids that I use and different assistive devices that I find very helpful. If you're new here, my name is Nikki. I have multiple chronic illnesses and have issues with mobility and chronic pain and a bunch of other things. You can go back into my channel if you're curious about more details, but today's video is specifically sharing with you my favorite devices, hacks, those kinds of things. So if you don't know, I am on a feeding tube. I have a PEG J tube, so I feed into the J portion of my PEG, and I'm hooked up right now for about 20 hours a day. It used to be 18, but I'm not tolerating faster feeds right now, and so right now I am only tolerating like a longer stint throughout the day, so I'm attached for a good chunk of the day. So we're gonna get started with my favorite feeding tube hacks, feeding tube accessories, and supplies that I find help me manage having a tube best. So just give me a minute while I gather my supplies. First off, let me show you. In the corner of my room, I have this caddy, and so in the caddy, I have it organized for all of my tube care stuff. Up here is kind of miscellaneous. This is all of my syringes. This one is all of my bags, and then the bottom one is also miscellaneous, and then the very top, I have this little container, which is very convenient, and I store all of the gauze that I need, my swabs, and different creams and stuff that I use for tube cleaning on a daily basis. I keep in this container up here. And so we're just gonna go through some of my supplies. I have done supply hauls, but I haven't actually talked much about what I use. So with my supply company, I don't get like a lot of options. So basically I have a nurse and a dietitian that follow me for my tube care and my feeds and stuff like that, and so they basically just give me SAP numbers, and then I give those to the supply company. So those SAP numbers are based on what the dietitian and the nurse has looked up for me, so I haven't personally been able to look through a catalog and pick my own supplies. It's just kind of like, these are the things that we think that you'll need, and if there isn't something that they provide, I pay for it. So, and just buy it at a local pharmacy or whatever. So starting off, I have two different sizes of gauze, and that is because I prefer to use these small 2x2s around my tube, and you can get split sponges normally, but you can't with my supply company, so I just have to get normal 2x2s and then cut them, which is fine. I mean, it's an extra step, but whatever. So I use these around my tube, and then the bigger 4x4s I use for cleaning my site. I just prefer it that way. I know some people will use like face cloths or something else, but I just feel cleaner with using like disposable gauze. I used to cut them in half so that each little package would have 4 uses instead of 2, but it's just been taking extra time, so right now each package has two for one-time uses. Something that I pay for are these little swabs. You can't really see them, but anyways, it's just basically a long Q-tip, and they're sterile. I use these around my tube. I guess you could use regular Q-tips if you're okay with them not being sterile. I know that the feeding tube site doesn't have to be sterile necessarily, but I just want to try to prevent infection as much as I can, so I prefer to use sterile swabs. This is a jar of saline water, which I also pay for, and I mean, it's pretty inexpensive. This jar lasts me a long time, so I use this for cleaning my tube. Saline water can help prevent granulation tissue, and so that's why I use that. The other thing, 2 things that I use around my tube. So these are very essential for granulation tissue. So the first one is this one. It's called Granulotion. I bought this off of Amazon. It was very expensive. This is literally 0.5 ounces, and it was like 50 bucks, but this stuff works so well on granulation tissue. Before buying this, I was just instructed to use a normal like zinc-based barrier cream and mix salt into it, and it burned so badly that it was actually making my stoma worse and not better. And so that's why I bought this, and this makes my stoma look so good. So basically I use this directly on the granulation tissue, and you only need like a tiny amount. So that's, you don't need a lot, which means that this will actually last you a while. And then I use Desitin, which is a zinc-based, I mean, you can get it in the baby section. It's like a diaper rash cream basically, but I use this around my stoma, around the site, so not on the granulation tissue, just so that there isn't irritation, or when my stoma is leaking, it's not gonna, the skin around it isn't gonna get irritated, and so that's why I use both of these. If you are someone who has really sensitive skin like me, I have like adhesive allergies and really sensitive skin, so it's taken me a bit to figure out what tape works best for me. I know some people don't really care if their dangler tube is dangling, but personally it makes my stoma really irritated, and so I keep my dangler tube taped to my stomach all the time just to avoid tugging and irritation. And the tape that I find that helps me best is Hypofix tape. It's basically just like almost, it's like a fabric-y type tape on the one side, and I just find that this is the least irritating on my skin. It's still very irritating, especially when you're changing out the tape every day. So if you're someone who has really sensitive skin to tape, I would also recommend using a skin prep. This is it basically creates a barrier on your skin so that the tape is on the barrier and not directly on your skin. And so when I don't use the skin prep, I get blisters from like any tape. It's just a little bit better when I use Hypofix. But with using skin prep, I am able to keep my skin looking a little bit better and not quite as irritated. And I also pay for this, but I have an appointment with my dietitian and my nurse soon, and I'm gonna ask if they have something like this, because I know that my supply company also provides supplies for ostomy patients, and I know that they use skin prep type things. So that's that. This isn't something that I've heard of other people doing for their tubes, but I personally use alcohol swabs every day. I know people are probably gonna comment in here, you shouldn't use it because it will break down the plastic or whatever, but this is just a personal choice. I use it to clean my dangler tube every day because I tape my dangler tube down. I don't want the adhesive to build up on my tube, and so I like to wipe it down, and then I also just like to sanitize the end and the tube in general, because it's a dangler tube. It sometimes dangles in places that I don't want it to go and are not very sanitary, so I just like to make sure that my tube is clean, and it also prevents infection, so that's just my own personal choice. And then another thing that I do pay for, even though I am provided with tons of syringes with a tip, like a screw-on tip piece, but personally when I'm flushing my G portion, I just find that these catheter tip syringes work so much better, and so I just buy cheap syringes and use that to flush my tube. I only ever use my G tube for draining when I'm feeling really unwell, but I don't do that very often, and so I only like use this to flush my tube. I do flush my tube every day. I flush 20 mLs through the G portion of my tube, just because there is backflow of contents in my stomach that come up the tube and can make it look really gross. And so just to prevent my G tube from becoming clogged, I use 20 mLs of water. So during the day, I just have my feeding tube on a pole, which in my house is not the most accessible because my house is not all one level. So I'm constantly having to pick it up and put it down depending on which room I'm going to. It's technically like one level, like I don't have an upstairs. I do have a downstairs in my house, but I never go down there. So I'm just talking about in between rooms, there is just like an inch difference sometimes, and that's enough to make it really difficult to roll through the different rooms. And so sometimes, especially if I'm doing chores, I find it easier to use a backpack. Everybody has a preference on what backpack they like. I have the Kangaroo Omni pump, which is a 2-pump system, and I know that you can buy a specific backpack for it. It's just not cute, and it's really big and really bulky, and I knew that I could find something that would work just fine for a lot cheaper and a lot cuter, and so I bought my bag off of Etsy. This is a mini of that bag. I have showed it before, but I will link it down below. I'll also link some of the other products down below that I really like, so you can check them out if you are interested in them. But this one I got off Etsy from Hannah Canvas. It has one main compartment, so I just take my pump and I put it in the bottom there. I also then just take both bags. I usually only have about 500 max running through there at a time, and I find that if you just wrap the tubing in a very specific way, that I don't have it kinking and then I don't have it alarming. But I know that everybody's experience with the Omni is different. Some people have it alarming a lot and other people don't have as many issues, and so I personally find that this works great. It has 2 pockets on the side, so I actually keep medication in one side, and then the front pocket has some supplies in it, and then I also usually carry around, I have another like little pouch in here which I keep pads in, because I usually am attached to feeds when I leave my house anyways, so I just always have a couple pads on me. And yeah, I find this to be very helpful. Another thing, most people with pegs have a clamp on their peg so that there isn't backflow, and for some reason when they placed my tube they decided to not put the clamp on, and so for like almost the first month I had to tape my tube shut because when I like wasn't attached, because I would just have bile draining out of it like constantly, and I was like soaking my port covers and my clothes, and it was just really gross. And they did give me a clamp, and so I just have to finagle this thing onto my tube every day when I'm not hooked up to feeds, which is really annoying, but it's just what I have to do. And so if you don't have a clamp, you can actually get them on Amazon. I can link it down below again. If you don't have clamps and you would like clamps, I'll link them down below. Okay, last accessory for my feeding tube that I believe are 100% necessary, they're not just cute, are feeding tube sets. So I make these myself, so if you've been following along, I have an Etsy store. It's called Autumn in Burlap. I'll link it down below, and I'm launching these sets on Saturday, April 5th at 12 p.m. Central Standard Time. So I'm gonna just quickly take this moment to show you the spring patterns that will be launching. So the first one is this super cute floral pattern. So if you're able to buy each one of these separately, but you can also buy them as a set, and it's a little bit more affordable if you buy it as a set. So this is a port cover. I use this between the pump and the connector piece of my peg. I just find that for me it keeps everything connected properly, and it's the first line of defense when you come unhooked. This specific pump doesn't have an alarm when you come unhooked. It will just keep feeding, and so you will feed the bed, you'll feed your clothes, and it is a huge mess. But usually if I'm wearing a port cover, this will get completely soaked first before it soaks my clothes or the bed, and then usually by then, especially if I'm sleeping, I wake up because I notice that I'm wet and cold, and so this has saved so many of my clothes and from having to change the sheets at like 3 in the morning. So that's the port cover. I also really like to use the clips. This is a Tubie clip. So it just clips onto your clothing super easily, and it's just helpful to keep your tube out of the way. You can wrap and coil your tubing, clip it to your clothes, and then it holds in place with the snaps at the bottom. This is something that I don't personally use, are Tubie pads, but I do make them. Sorry, come on, focus, there we go. Okay, I personally don't use Tubie pads. I did at the very beginning, but I just found that it was an extra weight on my stoma, and it was creating pressure sores. I don't use them against like my skin. I was using them like on top of my bumper because I have a peg. That you are able to use these under a peg if you want to. I just personally don't. And I also have a lot of drainage, and I just prefer to use gauze. So I don't use Tubie pads, but I do sell them. So those are on my shop. I will link them down below, and I will also just remind you of the date. They are launching on April 5th, Saturday at 12 p.m. Central Standard Time. So that's that. That set. Here's the other sets. Come on. My lighting isn't very good, but this one just has like very dainty little pink flowers on there. A cute gingham pattern. I'm obsessed with this gingham pattern. It's just so cute. And then this one is going to look a little bit more like worn than the others because I made this one for myself a while ago, but I am only getting around to posting this pattern now. It's just, they're all so cute and so springy, and the funny part is we're on like our third winter here in my province. We joke about first, second, and third winter because we will have snow and then like almost completely melted and warm, and then it'll snow and then it'll almost completely melt and be warm, and then now we're on our third round of it snowing. It's an April Fool's prank that the weather plays on us every year, but I'm gonna be putting out spring patterns anyways. Okay, we're gonna move on to a couple other things that I use as like an assistive device, I guess. I'm gonna start off with my bed. I'm gonna put in a clip right here. So because I am feeding throughout the night, it is recommended to sleep elevated, and this has changed the game for me with sleeping in general. I used to be a stomach sleeper, but then when I got this peg, I clearly could not sleep on my stomach, and I've been trying to train myself to sleep on my back forever, but the only time I've ever been comfortable sleeping on my back is since getting this bed wedge. And so it's a memory foam bed wedge. I love it. I will link it down below. It's also an Amazon product. And then the other one on top, it will just look to you like it's a normal pillow, but it is not. It is the brand Pillowwise, and the only place that I've been able to get it is my physiotherapist's office. I believe it was designed by a physiotherapist, and each pillow is measured specifically to you, so they take the measurements of your neck. They do like this little quiz thing to see what kind of sleeper you are, side, back, stomach, all of the above. And then they also measure the distance between your shoulder and your neck when you're lying down, and also the same on the back. They do a bunch of measurements, and then they line you up with a pillow that should work for you. They give you a 30-day trial with it so that you know if the pillow is measured correctly to you. And so I bought mine. This is not an ad. It's just the best pillow that I've ever had, and I never understood people who would bring their own pillows places, and now I do because this is my pillow and I bring it everywhere. I can show it like more close up when I enter in the clip, but it has like neck support, and it's beautiful. I love it. So those are my two like bed type assistive devices that I use. Some other ones that are really helpful are, of course, anyone who takes medication will find it very helpful to have some sort of storage for their medication to remind them to take it daily. I prefer the ones that have 4 compartments because for a while I was taking medication 4 times a day, and all of the other ones that I was finding were either 2 or 3, and it just wasn't enough. And I like the 4 compartment. I also like that this one specifically is all like separated, so I can take out that day and take it along with me instead of having to take this giant thing with me. So that's just a regular pill case. Now going on into more pain management, things that I have used to help manage my pain. I have a lot of joint pain, I have endometriosis, and so I have a lot of pelvic pain. I have a ton of abdominal pain. I just have a lot of pain in general, and so I'm going to go through all of the devices that I use for that. Aw, you need some attention. The poor baby, she just wants mommy. She's just off camera here. She came for a chin scratch. You little whiny. Yeah, you a little whiny. It's okay. We all get a little whiny sometimes. Starting off with one of the oldest things that I've tried is a CBD cream. So this I have used for my joint pain in the past and also for like my abdominal and pelvic type pain. I've tried a bunch of other things like that, like icy hot and other type creams. I guess the A535 type rub, but it was like prescription strength. And I just never found that those worked for me. I've also tried essential oils on my joints and it helped for a little bit, but this is the only one that I actually found that worked for me because it relaxes my muscles and the joints and relaxes everything because it has CBD in there. It does not have THC, or like everything has a little bit of THC when you're buying a CBD product, but in Canada, you have to be over 18 to be able to purchase something like this, and so it's the only CBD type product that I use, and I have really liked it. I am not someone who is endorsing like CBD, I guess, but I really like this product, so take that as you will. Other things. I've already talked about my heating pads. I have so many heating pads. I have 2 that I use every night on my bed, one for my neck and the other one for my abdomen and pelvis. I only have them on a 2-hour setting, and then if I wake up in the middle of the night needing it, I turn it back on, so I'm not using it all night long. This beautiful device is a portable heating pad that is battery operated. This is just a pretty generic one. It's a Sunbeam. It's just the cheapest one that I could find. It works super good. It's very low profile in my opinion. I used to wear it every single day when I worked in an office, and it saved me on my periods multiple times. And I ended up getting a second one because my other one was dying, and so now I have 2 battery packs, which is a complete game changer because I can charge one while I'm wearing the other one. So if you don't have a portable heating pad, I highly recommend that you get one if you're someone who has period pain or abdominal pain or even back pain, because you could use it on your back too. Hamburgers. I am someone who has a ton, I have a whole drawer, maybe even 2 drawers of braces and equipment that I have used or tried. Lucy, don't push that. She's pushing my phone. I have tons. I started off with just drugstore ones, and I have graduated to like physio grade ones. So I got these last year. I don't remember. They're the Bauer Fiend braces. I really like these because they're skin color, and you can also pull this piece to adjust where your patella sits, and I love these. They feel very supportive, and they're by far the best knee braces that I've had. Other braces that I find helpful, recently I bought myself a neck brace because I've been having a lot of cervical issues, especially when I'm upright, and so when I'm doing things like sewing or baking or doing my nails, I just find that I need extra support. Otherwise, after doing those activities, I am stuck in bed with my heating pad because I'm in so much pain and have such a migraine after that. So I use this while I'm sewing. I don't use it all the time. I just use it for specific activities, and it helps me a lot. Another one that I find super helpful is this hip brace. So it's basically, kind of reminds me of hockey pants, but it's basically a pair of bike shorts with a bunch of straps and things connected to it. So I have shown how it works before, but there's straps around the legs to keep it from sliding down. There's also some like silicone on the inside to give it some grip. This specific one has wiring all the way through the back and the sides, and so when you pull on these Velcro pieces and strap them across your body, it pulls tight the wiring that's in here. I guess it's not technically wiring, but you know what I mean. And then this also has straps that go across in front of the leg, and so this little piece here, this dial, also tightens that strap so that it's pulling everything and holding it in place. I find this very helpful for my hip pain. I don't use it quite as often anymore, not because I don't have hip pain, but because now my feeding tube just kind of gets in the way, and I just still have a lot of abdominal pain, and anything pressing on my stomach is really uncomfortable. But I do find this to be very helpful. I've tried all kinds of different foot support type things, but the ones that I've found to be the most beneficial are foot orthotics. So these ones are specifically measured to me, and they just slip right into the shoe like any type of orthotic. It can go in basically any shoe. So that's what I like about these. So I use these for shoes that are like cute shoes usually, and then I like to use my AFOs for longer outings, or if I don't care what kind of shoes I'm going to be wearing. I prefer my AFOs because my ankles like to roll outwards, and then I'm standing like on my ankles like this usually, and that for some reason makes my hip pain feel better when I'm standing on the sides of my feet, and so that's not good for my ankles or my knees, and so I have AFOs to keep me aligned like this. And I've actually found it to help my hip pain significantly, to have proper alignment of my ankles, and I find that it also turns my knees to be forward facing as well, instead of what they usually are, which are a little bit wonky. So AFOs are definitely a must for me. I have a couple others that I use. I have ankle braces for when my ankles are acting up in the summer months, and then I also have wrist braces for my wrists, and I also, one of them is like a thumb brace as well, because one of my thumbs is kind of wonky. So those I find very helpful as well. Those are all the brace types that I have. Assistive devices. I like to use forearm crutches because I just find the way that you hold them and the way that they support you are better for me than a normal cane. So a normal cane, you would be forward facing. I'll see how far back I can get. You'd be forward facing like this, and your weight would be like forward. I prefer having the support here at the back of my arm, and then I just lean on it like this, and you can walk with it like a cane. It's just a preference in the way that my wrist is positioned really, and the support of this extra piece on my forearm as well. I just find it helps with my stability and takes the pressure off of my hips, which is the main reason why I use a forearm crutch, is because my hips are really bad, and my knees and my ankles. I'm a lot more steady with a cane, so I use these all the time. I have 2 forearm crutches because it comes in a set, because you can use them as crutches. I just only need one at a time, so I keep one in my house and then one in the car for outings. I also have a wheelchair. I use my wheelchair for long outings or distances. Basically, how I use it, I know a lot of people question whether or not it's time for a mobility aid, and I've heard a lot of people say that if you are thinking about it or dreaming about it or questioning it, that's usually a pretty good indicator that you need one. And so my forearm crutches were the first mobility aid that I got other than my braces. Basically, don't be ashamed to use one, but I use my cane for shorter outings. So if I'm going to like 1 or 2 places, usually one place. If I'm going to one place, I use a forearm crutch. On a really good day, I can maybe go to 2 or 3 places with a forearm crutch, but then I'm like dead for the rest of the day. usually for any places that require you to stand for longer than like 20 minutes, or places that I need to go to more than one place, I will use my wheelchair. Just because I don't have the capacity to stand for very long, even with a forearm crutch, and so I just use my wheelchair for longer distances. Yeah, those are my mobility aids. So I also have like a parking plaque so that I have more accessible parking, which has been very helpful for me as well. Now I'm going to get into more of like the random mobility and accessibility devices that I use. Here are some of my favorite kitchen devices. So because my wrists are so bad, I have one of these handy dandy jar opener things. Of course, if you have more like disability in your hands and wrists, this probably won't help you very much. You would need something that maybe opens it for you, but I just have a lot of weakness in my hands and my wrists, and they have a tendency to want to dislocate when I try to do normal people things. So this, I just find it gives me the extra leverage so that I'm able to open something. I'll demonstrate for you on my water bottle. It has 3 different sizes. My husband is texting me. So here I've put it on top of my water bottle. You squeeze and then you open. So it's very easy to use, and so I love this. Some other of my favorite handy dandy gadgets would be my onion slicer. I just got this at the dollar store, and you just put onion pieces in here and then you pull this and it cuts onions for you. Very small too, so if you don't like onions, this gets it like microscopic. So I find this very handy. And then another thing that I like to use is this little garlic bulb thing. So there is garlic in here currently because I just made soup, but you put a couple of cloves in here, you shut it, and you just twist it, and it minces the garlic for you. Super easy, and I love it. It's also another dollar store find. Some other random accessibility type things, if you're someone who's just really cold and maybe don't have the ability to like walk around with a blanket attached to you all day, I would highly suggest you get one of these handy dandy blanket hoodies. This is mine. It's a hoodie, but it's a blanket. It's basically a knockoff of the hoodie, and I love this because when it's super duper cold, I just throw this on and then I'm basically wearing a blanket all day, and it's fantastic. I especially like it in the summer months, like in August here. It's usually really cold in the mornings but really hot during the day, so that transition, I only want to put on one outfit. So clearly I'm going to put on shorts in August, but it's really cold in the morning when I have to take Lucy to go to the bathroom, so I wear that around my yard. I don't really care if my neighbors see me. My neighbors are my in-laws, and so they don't really care. Other things, I personally don't have a shower stool, but you could have one if you prefer. I just personally sit down in the shower, like on the tub floor, and I don't find that to be gross or whatever. But of course, someone who has a harder time getting back up would want a shower chair, but I can still get up. I just need to be sitting during the entirety of the shower. Other things, I of course use chairs and stools everywhere. I'm actually propped up on one of my chairs right now that I usually have in front of this little area for when I'm getting ready. I just find it a lot easier to do things sitting than standing, because standing really aggravates my joint pain and it also aggravates my POTS, and I'm just able to do things for a longer amount of time if I'm sitting. So I have bar stools in my kitchen for doing dishes and for cooking, and then I have this stool that you're propped up on. It's just like a little seat for doing my tube care, and I also often take it to the bathroom to do my hair and makeup as well, or I'll just sit on the floor in the kitchen where we have a big mirror and I do my hair and makeup there. Oh, I forgot one thing here. Also for my POTS, I haven't talked a lot about products for my POTS, but of course my cane is one of those things that I use to help with my POTS. For some reason, it just helps to have something to lean on and to hold your body weight. Some other things, of course, are salts or electrolyte tablets. I can put my favorite ones down below in the description. They're also an Amazon product. I really like the salt stick ones just because they have more flavors than the Vitassium, but it's honestly personal preference. So I'll link those down below. I also really like the Roar electrolytes. I just prefer the taste, and they have like good ingredients, so I just feel really comfortable using those. I know some people like Liquid IV. I've used that in the past as well, but I usually only put half of a packet in water because otherwise I just find it to be too sweet. Some other things, I have compression socks. I do like these, I just wasn't finding it very helpful, and so I just stopped wearing them, but now I'm having a lot of blood pooling, so I'll have to start using these more. Mine are specifically measured to me, but you can kind of just get them anywhere. And I think that is all of my assistive devices, mobility aids, hacks, and equipment that I use to try and manage my symptoms on a daily basis. Oh, I forgot one more thing. Stomach related stuff. I don't have it with me right here, but I can link it down below again. If you're someone who struggles with a lot of nausea, bloating, maybe even abdominal pain. I haven't noticed with my abdominal pain personally, but I'm a unique case. I really like these Suku gummies. They are the Bloat gummies. I'll link them down below. They are an essential in my house for if I eat anything by mouth. So even though I am tube fed, I do have the ability to eat a tiny bit by mouth, and I mean it, like a tiny bit. Like it's like a couple of bites, like 3 bites usually, maybe a little bit more on a good day, but I still get a ton of abdominal pain, bloating, feeling nauseous and sick after I eat. And so I usually like to use something more supplement-like before going to more hardcore nausea meds, and these often work for me. I usually only need to take 2 of these gummies after eating, and it resolves my abdominal discomfort. Not all of it, but like it gets me to a point where I don't feel like I'm gonna throw up. But if I'm still feeling that way, I usually go over to my nausea meds. So if you're someone who also struggles with stomach related things, these are the best ones that I have ever had, and I've tried quite a few different things, so I highly recommend them. Anyways, this video was long, and I'm sorry about that, but I hope that you found this video to be helpful. If you would like to continue to follow my journey, it is ongoing, and I would love to have you. I love that I've met so many wonderful, amazing people through my platform, and I would love to have more of you join my journey, and you can do that by subscribing. You can also come find me on social media. It's the same handle on my Instagram as it is on my YouTube. Otherwise, I post every Thursday. If there's something that you would like to see, you can always comment down below, and it will give me future video ideas. And yeah, like I said, I post every Thursday, so I'll see you guys next week. Bye!